Well, if you ordered those free at-home COVID tests from the federal government, you need to check your email. When your tests are on the way, you're going to see an email like this in your inbox. When to expect the test to come to your mailbox. But since temperatures are so darn cold, you need to bring them inside pretty darn quickly. Our Lauren Kostick joins us with what experts say once the tests freeze, they may not work.
You ordered one of those free at-home COVID tests, you should be getting it in your mailbox or on your front porch any day now. But experts say don't leave it outside for too long. That's because this cold weather could impact your results. Every COVID test is a little different, but most require storage above freezing, an issue for those living in cold states like Indiana.
Tests themselves say right on the packaging that the temperature should be anywhere between 35 to 36 Fahrenheit up to 86. So that's sort of in that non-freezing range, not too cold, not too hot.
Dr. Sean Granis with the Regenstrief Institute said the liquid inside the kit can freeze, creating a false negative result.
If they're not kept in that range, what can happen, there's protein in the liquid in the testing kit, they can break down. It's called denaturing.
If your test kit sits in the extreme cold for a long period of time, you can always check the liquid to make sure it's still usable.
If the liquid freezes, the advice is not to use it because it's likely defective.
And the FDA also says it's important for your test kit to be used at room temperature. So if the liquid isn't frozen, leave your test out so it can warm up.
The best suggestion is if you receive an at-home COVID test during extreme temperatures, high or low, to let it return to room temperature, look at the packaging for directions there, and then take the test as you would.
Dr. Kara Cecil says the same guidelines also apply when it comes to storing your test at home. Don't leave it in your car or garage.
Typically, the guidance is to store these kind of medications and tests inside, away from areas of high humidity, but at a constant temperature.
So the bottom line is bring in your test as soon as possible and also keep an eye out for any delivery updates.
Well, IU Health announced they're planning to resume elective surgeries soon now that the COVID cases are dropping. That's good news for people who have been dealing with health issues while these procedures get rescheduled.
Living in pain every day is not fun.
Off and on for 2 years now, millions of people have had their elective medical procedures canceled or delayed. From joint replacements to tonsillectomies to colonoscopies.
There are surgeries that we would very much like to get done to serve our patients that we haven't yet managed to do.
But now, relief finally in sight. At IU Health hospitals across the state,
we're actually having conversations right now about starting those procedures back up as early as next week.
And other health systems are considering the same, including community health in early February. But none of it is written in ink. A community spokesperson saying, our team is regularly assessing the situation and the timing may change based on bed capacity. Patients, doctors, and nurses alike all crossing their fingers that better days may finally be ahead.
And experts at IU Health also weighed in on the best ways to keep your kids in school. The answer is still get kids 5 and up vaccinated and wear your masks. Raleigh Hospital for Children is still seeing kids getting admitted with severe cases of COVID-19, but breakthrough cases in children already vaccinated are shown to be less severe. The vaccine will also keep your child in the classroom if they're exposed to COVID-19 until they show symptoms or test positive. Pediatric doctors say they've talked with the CDC and they're hoping that kids under 5 will be able to be vaccinated soon.